My dear students, I hope you recognize what is on the screen. R.A.T.S, of course, we all know. But then these words, chips and game, which mean charts in pathology for students and gross and microscopy explained. These are two terminologies which we shall be having in mind. And I shall be taking a series of classes in the form of charts. Hope you people will be benefiting from it as and when we unravel the mysteries of the charts. Chips and game for rats. Multiple myeloma. This is the second chart that I am handling. Again, look at the plethora of pictures staring at us. I would like you people to be very cautious because a chart is different, practical is different, and multiple myeloma by itself can be an essay question which we fumble at. So kindly follow my explanation, which will be useful for charts as well as viva voce or any of the identification. Always, I would like to concentrate on the blood picture and the bone marrow picture in hematology. These are the golden yardsticks which we should never miss. Multiple myeloma, obviously it is a lesion where a lot of plasma cells are seen. And where are the plasma cells present? This is a bone marrow smear. Look at these cells. The cells are large. They are oval. Oval is a two-dimensional word. In fact, my professor used to call it as ovoid, which is a three-dimensional word. And see the nucleus. It is eccentric, that is outside the center in location. Surrounding the nucleus, there can be a clear space, which is called a perinuclear halo. Also, if it is going to be a mature non-neoplastic plasma cell, you can see a cartwheel pattern of chromatin. Now, this is a case of multiple myeloma. I find that there is an obvious increase in the number of plasma cells, and some of the cells are immature. They are called plasmablasts, and they will be having a different pattern, which I shall be explaining. So increase in plasma cells, which arise from the B cells, and it is a B cell dyscrasia or a neoplasm. Whenever I say the bone marrow, the next one ought to be the peripheral smear. Look at the peripheral blood picture. This is what I see. This is called a stack of coins, as though the RBCs are placed on top of each other, which we call a rouleau formation. MCQ. Rouleau formation is a classical presentation seen in multiple myeloma. Also, the background will not be clear because there is a proteinaceous precipitate. After all, these are cells which will be producing the immunoglobulin. So there will be a proteinaceous precipitate. A third point will be when the technician or the hematologist tries to make a smear, it is difficult because the smear is quite thick. The blood is thick and tenacious. Difficult to make a smear. I repeat, rouleau formation, proteinaceous background, difficulty in making a smear. 2 points are over: the bone marrow picture and the peripheral blood picture. And what are the variants that I can see in the plasma cells? These are things which you people will have to remember. Variants of the plasma cells. The first one is called the Russell bodies. The Russell body is nothing but a cytoplasmic inclusion. of the immunoglobulin. So it is precipitated, it is pinkish in color over here, and it is the Russell body. So whenever I say an intracytoplasmic inclusion, that means there has to be an intranuclear inclusion. We shall go straight to Duchess inclusions or cells. So this is the nucleus, and within the nucleus, I am finding an inclusion which are called as Duchess body, and the cell can be a Duchess cell. The third one that is important will be a flame cell. Look at this, as though the cell is burning. It is called a flame cell. Compare it with the plasma cell over here. Here it is totally different. Usually it happens in a case of a plasma blast. The cells will be more round. They will be having a pinkish cytoplasm, and the rim will be almost reddish. The cells can be more round in appearance rather than ovoid. These are flame cells. And the fourth variant can be the mulberry cells or the Mott cells, which are seen. I am finding multiple bubbles over here in the cytoplasm, which produces a grape-like appearance. So these four variants we shall be mentioning. There is also a differential diagnosis. In this case, I am finding more of round cells looking like lymphocytes. This is also a beta cell, B cell neoplasm. So this is called a Waldenstrom's macroglobulinemia. When you are asked about the B cell dyscrasias, we'll mention this, but this is an essay question for us. So it is important. Now that you are having a clear view of it, what can be the presentation? The presentation is not for us to just enumerate and then reproduce, but because these can be given as a clinical history. The patient can be having a bony pain, there can be an anesthetic sensation because of the compression of the nerves, bladder can be atonic, and there will be accumulation of urine. Sometimes there can be a soft tissue mass also. Swelling obviously is felt in this case. Pathological fracture is one of the usual features of it. Amyloid deposits can be seen in microscopic picture of the kidney and other organs. The bone becomes osteoporous. There can be a loosening of the teeth. Hemorrhage is obvious. So these can be some of the clinical features. And the classical history is the patient will be 50 to 60 years. Less than 40 years, it is not multiple myeloma. So please remember these. Patient about 50 to 60 years having a history of a fracture, and then you are given the bone marrow, you should be able to make a diagnosis. All these other things can be questions for us in the Viva. Now, what are the other investigations which can be done? Look at this. This is a history of the skull or an X-ray of the skull, wherein I am finding multiple moth-eaten appearances, as though something has eaten away the skull. These are called as punched out lesions. Punched out osteolytic lesions, classical of multiple myeloma. And what are the other bones which can be affected? The skull is a flat bone. Remember the other flat bones. The scapula, for example, ribs, pelvis. After that, you have got the vertebrae. These all can be involved in a case of multiple myeloma. Also remember the femur. Sometimes there can be an extraskeletal solitary myeloma. When it is present in multiple sites, it is called multiple myeloma. One other important parameter will be the erythrocyte sedimentation rate. So the last one is a picture of the multiple myeloma. Here, the ESR is almost 100 or more. Normally, it is about 3 to 7 millimeters per hour. Here, it is 100 millimeters or even more. And there are the other things which we will not go into. I will be taking it in a class on ESR itself. Coming with the investigations, I find that there is the heating of the urine. Classical test called the Benz Jones protein. All of us know. It is a representation of the kappa or lambda chains which may be present in a case of multiple myeloma. On heating, about 40 to 60 degrees, it becomes turbid due to the precipitation of the protein. Further heating, it becomes clear. So this is supposed to be indicative of Benz Jones protein. And if it is going to be cooled further, it reappears. The turbidity reappears. Whereas if the turbidity remains even on further heating, it is negative and it can be classically any type of proteinuria. These things we will be having in mind. Benz Jones protein. Protein electrophoresis is one of the classical tests. In fact, this also can be given in the chart for you people. What is electrophoresis? After all, any substance or the components of a substance, they travel at different speed. Therefore, they get separated. Here I am finding the albumin and then I find the gamma chains over here, which are the M proteins. Not much rise over here. It is a normal electrophoresis. And then I got an alpha 1, alpha 2, and the beta proteins. But in a case of monoclonal gammopathy, such as multiple myeloma, albumin is here, which I see as a thick band. And again, I'm seeing a thick band, which is represented graphically. There is a rise. And this is called the M protein or the M band. Classical of multiple myeloma, diagnostic. When I say diagnosis, there are some diagnostic criteria. One, the plasma cells in the bone marrow must be more than 30%. Two, there will be osteolytic lesions producing punched out lesions in the skull and other bone. Three, the serum calcium will be raised because of osteolysis. Four, there will be protein electrophoresis, which can be positive. Benz Jones protein is a minor criteria which may or may not be positive. The salient points are, I would like you people to remember the clinical picture because that is going to be given as a history for you. Blood picture, already mentioned. Bone marrow, describe the plasma cell, cartwheel chromatin, perinuclear halo, plasma blast, variations of the plasma cells. ESR is raised. Radiology, you will have to explain, and this is electrophoresis. And these are the references for you people. My book, 1 page, will be giving this. R.A.T.S. I would like you people to kindly go through the class on multiple myeloma. Meningitis is okay, it's a short note. But multiple myeloma, we cannot take any risk. Robbins, Lab India, I would thank them for the picture of it. Webpack, again for the series of pictures. So I would like you people to kindly go back and read. R.A.T.S. Robbins, 1 page. Thank you. And this again is an entire summary of it. Having listened to my class, now you people can recollect the entire picture by one glimpse of it. And that is the advantage of charts in pathology.